So hello, I'm going to wait a couple more minutes to see if we have some additional people coming in. And in the meantime, thank you for joining me. My name is Yvonne Blanco. I am a broker manager here at Insurance Advisors Direct. Thank you so much for taking the time and joining me to find out the LIS and spend down fundamentals. We won't go really deep diving into these, but it'll basically be the basics of what those, how people qualify and what these terms mean. So with that, please remember anyone that is attending, we'll go ahead and get some great reference handouts. I'm really big on providing single reference sheets to our field agents so you can kind of have a quick glance and figure out, where your member or what they qualify for, what plans that are right for them. So just if you are on here, I will make sure that you get our nice little job aids. So with that, my contact information is there, obviously. You can go ahead and email me or always give me a call. So let's go ahead and get started. So with the LIS Fundamentals, obviously, we have LIS, but it's also known as extra help. So, and that extra help is administered by Social Security. So as we know, Medicaid is administered by the state, and LIS or extra help is administered by Social Security. Usually you're auto-enrolled into an LIS by Medicare, but you can also apply through Medicare.gov, which then would go ahead and lead you into the SSA website. And that is usually where we will access that application. And I have a couple slides coming up that'll show that for you. Individuals receiving extra help, they do fall in an SEP. We'll go ahead and review what those SEPs. We have some new SEPs because of our COVID-19 rules that have come out and how that qualifies them for an SEP as well. But please remember that LIS is not Medicaid. So I will go ahead and keep reminding you because there's a lot of individuals that can get a little confused because of the where the money is allocated and how it is getting paid. So I think people can get a little bit confused if they're extra help and their Part B is getting paid by the Medicare Savings Program, which is also part of the Medicaid program. So not to get too confusing on that, but so now we want to know, why would anyone want to apply for LIS, or why would you want to know these options for your possible members, possible clients? Well, these are my top 5 benefits on extra help and what it can provide the consumer. Obviously, that Part B premium help, depending on their level of income, it can go from anywhere from paying 100% of that premium all the way down to 25%. And some of these individuals that are living on just Social Security, maybe a small pension, might qualify, but usually if they can have that Part B help, you are just, changing a quality of life there. Of course, it allows one quarterly SEP. So you have one quarterly for the first 9 months of the year, and then we fall into October 1st. We do have job aids for those SEPs as well, what those periods are. If you guys need those, please text me or send me a chat and I can get those to you. If you are on extra help, it does provide a fixed copay on your prescriptions. Each carrier is a little bit different, so you do have to reference those summary of benefits. It does provide that coverage through the donut hole. And one of the great, I think, coverages is they don't get that penalty for late enrollments on their Part B or even on their Part D. So now LIS can impact the prescription drug costs. It impacts their premiums, their deductibles, and their copays. It could be from anywhere from $0 to $9.20. On this slide, I just basically kind of gave the rundown on what we see time and time and again, whether it's in our trainings, but we see them also on that Medicare.gov site. So I made it kind of simplified just what a broker needs to know. So, and then keep in mind that, you know, if they are getting extra help, it all depends on the level of their qualifications, their income levels. Annual prescription deductibles can go anywhere from $0 to $92, depending on the carrier. So want to reference those costs. 30-day, 90-day supply, a retail network pharmacy for generic drugs usually will be $0. That's on your mail order. Obviously, on some of these carriers are $0. And all the other drugs can be $0 up to about 15% of the total cost. So make sure that that is something that you pay attention to as well when you do run across anyone that's LIS qualified. We have these nice little job aids. This is a great little chart. We have 2 of them actually that I can go ahead and share with you. The reason for these is it breaks down on the one side Medicaid eligible, and then you'll see full subsidy. That will be mostly like your LIS, and now you see those levels. This will also give you the prescription co-payments on the bottom, those amounts that are basically, I would say, given these amounts by the extra help guidelines, as opposed to the carrier's summary of benefit guidelines. This is another chart that we have that will show, you know, your income levels. So this is something that you want to pay attention to when you're talking to someone. They could tell you, oh, you know, I don't qualify for Medicaid, you know, but I can't afford a med sup, or maybe they're on a 0 premium plan, an HMO, MAPD plan that's just 0 cost. But wouldn't it be nice if you had this chart, you recognize that that individual can actually qualify for that extra help for their prescriptions, for the donut hole, and also for their Part B premium. I've known a few brokers that have helped individuals with that Part B premium, and they have now members for life. So this is a nice little quick job aid that you can glance to, see the income levels, and you're not their caseworker, don't get into that, but it's nice for you to have this kind of information at your fingertips as you're helping the communities. I went ahead and I listed all the states that are part of the MMP. The MMP demonstration program is where individuals that are on Medicaid and some that are on LIS will go ahead and get auto-enrolled into a state Medicaid or Medicare plan. So just wanted to kind of throw this in there. It's sometimes the Medicaid and LIS tend to blend together. And I think this is kind of a nice job aid just for the brokers that are in those other states to know if there is that, you know, Medicare, Medicaid coordinated benefits and insurance that they're providing. This is a quick little job aid that I did, so that way you can ask and get to know what are the eligibility information requirements that you might have. This also can help you where, say the person, you know, does make a little bit more and they're not going to be LIS qualified. Now you have this information to be able to do some of your cross-selling and also educating your members on a retirement plan. Just it's good information for you to have for your book of business. So I went ahead and included those as an intake form. So these are some of the SEPs that I was talking about that are coming out in reference to their special enrollment periods that you need to know because of the economic crisis. You know, some people have lost their jobs and, you know, due to, you know, being on furlough, they can no longer afford that job-based coverage. If they were offered COBRA, that is another SEP. So this is a really helpful chart. You know, previously uninsured individuals can now be an SEP. For timelines, please give me a call if you have any questions. We also have this chart that I can go ahead and pass out to our attendees or anyone that sees this webinar and would like to go ahead and request these forms. please send me an email and I'll go ahead and get these to you. So now, once you find out off those tables and in the income, how are you going to help somebody? Maybe just direct them on where they can apply for this LIS. So those charts will go ahead and give you that annual income. So you can see maybe a few dollars here and there, they're around that range. Then you can go ahead and direct your clients to apply through one of these three ways. They can go on the website at socialsecurity.gov. And actually, they can also go on the website for medicare.gov. And when they click on extra help in medicare.gov or get help with your prescriptions, it will actually funnel you right into the Social Security website. So I have that website here. Also, if you want to take down the phone number for Social Security, that's the 1-800-772-1213. If you're a broker and you've been working in this industry for a little while, everybody knows the 1213 number by memory, right? So that number's on there. Please go ahead and, take that down. Social Security Administration, you can always visit it in person, but because of the COVID, I don't know if maybe they're opening that up again, but I do know previously they were doing it by appointment only and virtual and over the phone. I do see some questions coming in the chat box, which is great. And we'll go ahead and address those right after the webinar so we can have kind of a discussion. And if you do see any of this information that you're like, Yvonne, that's not the information that I got, or you have other information that you've gathered, please share. The information that I usually research and I get it from, our government administrators, talk to people over Social Security, talk to people at the Medicaid office. The carrier broker managers have helped a lot with this. I go ahead and reach out to them so I can make sure that I'm giving you the information that you need, educating you, making you very knowledgeable, so that way you know where to plug in any individual that's coming in front of you. Yeah. So you meet them and you can go ahead and just say, okay, this person's LIS, or this person's Medicaid, or this person's a Med Sup, and giving you those tools and that information. So now, once they go ahead and apply, you can go ahead and let them know that they're going to have a review of their application. Usually Social Security will send a client their letter letting them know if they qualified or did not qualify. They also follow up with the client. I would say if you can actually follow up with a client, it builds that rapport a little stronger, and there's not going to be somebody else that's going to knock on their door and in a couple months, and now they're rewriting them on a separate plan after you've spent all this time. So make sure that you have that open communication. And of course, if the person has misplaced paperwork and they're like, I don't know where it is, that's okay. You can go ahead and call one of the carriers that you are contracted with, call their agent support unit, with whatever carrier it is, whether it's Molina, United Healthcare, Priority, any of these programs, you could go ahead and call and find out what their status is if they've been accepted on that LIS program. I took a little snapshot of this. I don't know if many of you know that you can actually order pamphlets like this through Social Security. They're at no cost. I think you can order about, and correct me if I'm wrong, about 15 of these pamphlets. You can also order the Medicare and You book to have a couple of those handy. So when you go to people's homes, you can drop those off. But these are great little, it's called obviously Understanding the Extra Help with Your Medicare Prescription Drug Plan. And it is great information in here that, you don't have to redo, and you can just give those to the members. So with that, we're going to go ahead, and I just took some screenshots on what you're looking at when you're going to go ahead and refer someone to be able to apply for that extra help. I'm not saying to do it for them. Some brokers help them along, which is totally fine. But if you just want to go ahead and direct them, I think it's important for us to kind of get an idea of what are we directing them to. So there is a list of information that the client should go ahead and have or gather. So obviously their social security card, bank statements, if they have those, if they do have a certificate of deposit, or savings, their tax returns usually, will have pretty much everything that they need. If they do have a payroll slip, you want to have those. That's pretty much it. You know, when they're going to go ahead and fill out the application, it'll ask you for amounts. It's very, very quick, really simple. But I did want to go ahead and let you guys know what it looks like. So on the Social Security site, you'll see this kind of page. Might be a little hard for you guys to kind of view on the PowerPoint, but this is what it pretty much looks like. That is the link to this direct application. So I don't know if you want to take that down, but I'll go ahead and have that on one of our job aids. And then there's a little button on the bottom that says apply now, and it kicks you right in to the process. You just follow that application, you go all the way down, you know, it's step by step. You can't just, you know, miss a spot. So that should be fairly easy for people to do that. Now, I will say, if you do have any questions or problems on that, please just let me know. If you do make too much income to qualify for Medicaid, that is called, there's a couple of terms in when we go into this LIS and spend down, that is called excess amount. So we're going to go ahead and kind of shift gears from LIS, and we're going to start to talk about a little bit about what is a spend down. What does that mean, Yvonne? What's going on? Excess amount is one of the terms that you kind of want to know. That is when you make too much money, right, to qualify for Medicaid. And then, of course, spend down is the excess income on medical bills that you have to spend down in order to qualify sometimes for that extra help. When someone accumulates those medical bills greater than the excess income, they can get Medicaid for that month. So I'll say that again in a different way. So if you are accumulating, you know, your durable medical equipment, and I have a list of what qualifies as your medical bills, you know, that is taking all of your income, and now you're left with, you know, $1,000 for a family of two. You will then have a spend down and can qualify for that extra help. So hopefully that I have a couple more slides that'll go a little bit more in depth for that. So this is where I went ahead and kind of made a little example of a spend down. So sometimes real life situations kind of help us understand it a little bit more. So Sheila did make, you know, her monthly income, and these numbers are not according to some of them, but I just kind of threw these in there as an example. So if her monthly income was $1,280 and her Medicaid qualification she needs to qualify for Medicaid is $1,093. That is from the charts that we have. So that means she's making a little bit over about $187 over that amount to qualify. And so her medical expenses could be over $187, which would then be her spending down the actual monthly income because of those medical expenses. Does that make sense? I hope it makes sense. But these are the medical expenses that people will have, you know, if her income is only $1,200, $1,300 and she's spending, you know, $300 or more, now she's qualified as what they call a spend down. Eligibility requirements, children under the age of 21, adults over 65, of course. You're disabled or blind, families with one or both parents that are deceased, absent or disabled or out of work. So again, I really want to stress that it's important to remember that someone that's on a spend down is not eligible for the Medicaid D-SNP plans. So it's when you think, and I kind of want to retract that in the sense that it's not an always, and in this industry we should know it's not an always, and it's usually not a never. We can always have these gray areas, but rule of thumb, you want to go ahead and treat a spend down as a regular MAPD. Sign them up on that. Safer for you, safer for the member, because if in that individual qualified, we'll just say qualified for a spend down and Medicaid for that 1 month, they have to keep qualifying as they go every month. And if they don't, on some of these plans, they will get kicked off that DSNP. So now you have somebody that's been disenrolled and you got to go enroll them. And it's a lot of work on the broker to go back and forth, and a lot of customer service, making sure you're answering questions. So, you know, that's just my recommendation. That was the recommendation I got from carrier broker managers, that what they advise agents is if you do find a member that's on just that cusp of a spend down, you know, that it could go either way, write to that member on a regular MAPD plan. I'm open for discussion for this. Obviously, I think it's an interesting topic because there's some people that spend so much money on their medications and their medical equipment that they can't live, you know, on that income that they have. And there's other programs that can help them. Again, you don't want to be their caseworker, but you do want to be informed so you can help your community, right? Also, medical bills that can be counted towards, and this is the list. This little chart is one of our handouts that we'll be giving to individuals to kind of let you know what goes towards that, qualifying you for using those items as a spend down. So, you know, your parents' bills for children's spend down, bills of the living children with living or children that are living with you. So I went ahead and I just kind of wrote those down. I won't read those to you since it's going to be a handout, but if you do have additional questions, please reach out and let me know. So that's pretty much it in regards to that. I do have a 2021 LIS reference sheet that will be given out to everybody. That gives you the different categories of what a level 1, level 2, level 3, and I think you probably have seen in the different carriers that they'll reference an LIS 1, LIS 2. So I do have a reference sheet for that. I do want to thank everybody that has joined in. I want to take a look at and see if we have any questions that I could go ahead and address. We can apply for them from what I understand. Yes, Danny, you can. If you are together with them on that website, totally. I've helped brokers. I actually went with a broker to one of his appointments and we helped that member write on the Medicare.gov / Social Security website. And when you go ahead and apply with them, you're just going in and entering, obviously with the permission from the individual, but you can have them right there on the laptop and apply with them for sure. So with that, I hope I answered those questions. And if you do, or if you have any discussions, I'm all about, you know, talking about our resources, information. If you do have any questions, if you ever need any help with this, please reach out to me here at IAD. And I thank you so much for your time and have a great weekend. Thank you.